experiment is collecting blood sample is a method used for laboratory analysis. It is a crucial procedure to diagnose and monitor disease. These are a few popular methods of blood collection. For instance, venipuncture, where blood sample is taken from the vein, and the skin puncture, also known as capillary puncture, is where blood sample is withdrawn from the capillary.
These are the equipment and materials needed to perform capillary puncture. First, capillary tube, lancet, alcohol swab, gauze, sealants, band-aid, and also biohazard container. Equipment and materials needed to perform a venipuncture are vein container and needle, blood tubes, gloves, tourniquet, alcohol swabs, cotton ball, and puncture-resistant sharp container.
The patient's finger was cleaned by using an alcohol swab. The alcohol was left to dry. Next, the lancet cap was removed. After that, the lancet was placed at either lateral side to avoid bone injury. Next, the finger was pricked by the lancet sharply and quickly. The lancet has been removed into the biohazard container. After that, the first drop of blood has been wiped by using the gauze. The finger was being squeezed to fill in the capillary tube with the patient's blood. The tube was placed in the sealant once it was full. The puncture site has been covered with gauze and the pressure has been applied to stop the bleeding. The gauze was removed and a band-aid has been applied to the patient's finger.
Procedures for venipuncture. The first step, all the equipment and materials were assembled and placed within safe and easy reach. Non-sterile gloves were put on. The tourniquet was applied on the arm, about 4 to 5 feet above the selected venipuncture area. The skin was disinfected using an alcohol swab for 30 seconds and allowed to dry completely. The cap was removed to unsheath the needle. The needle was inserted into the yellow vein container and screwed into the place. The needle guard was lifted and the cap was removed. The hole in the bevel edge of the needle was facing up and in line with the needle guard. The patient was asked to form a face so that the veins were more prominent. The vein was anchored by holding the patient's arm and a tongue placed below the venipuncture site. The needle entered into the vein swiftly at 30-degree angle. The blood was flashed back into the vein container. The blood was withdrawn for a couple of tubes. The tubes were oscillated for a few times. The tourniquet was released once sufficient blood had been collected. The needle was withdrawn gently using a swift backward motion. A cotton ball was applied to the site with a gentle pressure. The needle guide was flipped back into the place. The used needle was discarded into a puncture-resistant container.
There are a few types of tubes used in the venipuncture, such as blood culture bottle, blue citrate tube, red serum tube, yellow tube, green lithium heparin tubes, purple EDTA tube, and gray fluoride oxalate. In conclusion, these two methods have their respective advantages. Proper training and regular evaluations, especially for venipuncture in order to reduce non-compliance incidents, will result in higher standardization and contribute more to patient care. The procedures and safety precautions must be executed appropriately to get the best result.